Hello, how's it going?
Good, how are you?
Good. I'm Josh. I'm going to be doing the physical exam portion of your exam today. Does that sound good?
Sounds great.
All right. So before we get started, I got a gown here. I'd like you to change into that. I'll just step out and give you a minute of privacy, and then we'll go ahead and get started with your physical examination.
Awesome, thank you.
All right, thank you.
Come in.
Hello, looks like you got your gown on.
Yep.
All right, so for the first part of the assessment, we're going to take your vitals and just kind of do a few things like that, and then we'll start going after that from a head to toe assessment, and I'll just kind of be doing all the different examination techniques that we have. We'll start off, we'll measure your blood pressure first thing here. So I got a blood pressure cuff. I'm going to put this around your wrist, roll up your sleeves, that's perfect. Looks like you've done this a time or two. This around here. Alright, so I want you to rest your arm there just like that. Perfect. You're going to feel it start squeezing your arm a little bit, and it'll get to a certain point and come back down. We'll just give that a minute to start working. So it looks like your blood pressure is 102/71, which is an excellent blood pressure. Okay. Take that off your arm now. Alright, then I got a oxygen sat probe. We're just going to stick the probe. We're going to stick this right here on your finger. Just rest your arm down. This is going to give us your heart rate and oxygen saturation. Looks like your heart rate's around 80, 75 to 80. Kind of goes up and down right there. And your oxygen saturation is 97, which is perfect. Okay, so now I'm going to check out your pulses on both of your radial arteries here. So stick out your arm here. And then we watching the clock here. I'm just going to kind of test it for a minute. Alright, so I just got done checking your pulse and respirations. Your pulse is right around 80, similar to what the oxygen sat said, and your respirations, I got 16, so both of those are fantastic. Now, I want to take a look at your hands and just kind of visualize them. So let's have you stick your hands out like that. I'm just kind of looking for a couple things, different textures, color. I'm going to kind of check your cap refill on a couple of your fingers here. Perfect. That's good. Alright, so now we get on with the vital signs. We're going to start with the head to toe assessment like they mentioned earlier. So we're going to start by kind of playing around with your head, and we're going to do some of the facial things. I'm going to ask you to do a few things, and if you comply, it'll go a lot smoother. Okay. So right now I'm just going to kind of look at your head, look at your scalp. Have you been having any problems with your scalp or head? Okay. And I'm just going to kind of feel around in here for any bumps. A little sore there, it looks like. Okay, that looks good. Okay, so I'm going to ask you to do a few things. Sorry, I messed up your hair a little bit. Anyhow, so I'm going to have you turn your head to the left, and I'm going to kind of look at your motion there and checking out some of the muscles. I'm going to pull your hair back. Good. That looks good. Okay, let's have you turn your head the other way. Good. Any problems moving your neck like that?
No.
Okay, good. That's really good. All right, I want you to lift up your head and swallow for me. That looks good. Okay, that's good. So now I'm going to check some of your facial nerves and some of the sensation in your face. First off, I want you to give me a big old smile. Wonderful. Now give me a frown. Oh, that's perfect. That's perfect. Okay, now I want you to open your eyes really wide for me. Okay, and I want you to close them really hard. Keep them closed. Good. Doesn't look like you have any issues with any of that. I want you to blow up your mouth like big. Perfect. Good. Good. No problems with that. Okay. So now I'm just going to kind of check the sensation of your neck muscle here. I want you to bite down and clench your jaw here. I'm just going to kind of feel your muscles. Doesn't look like you have any problems with that. Okay. And I'm going to feel a couple of your sinuses real quick. And I'm here, so I'm going to feel your frontal and your maxillary sinuses. Do you have any tenderness when I'm touching right through here?
No.
Okay. Nothing at all? Okay. I'm going to feel back here, the back of your jaw. Is there any clicking or popping back there? I'm going to feel down here. Got a couple of glands I'm feeling. I'm also going to be feeling for some lymph nodes. You got lymph nodes that run all the way around your jaw here as well. Up underneath your chin and then down your neck, several places. Don't feel any swollen lymph nodes. Okay, that looks good. So now we're going to check the sensation of some of your facial nerves here. So I got a paper clip here and I'm going to be poking you with a sharp side and a dull side. And I want you to tell me the difference of what you feel there, okay? All right. Is that sharp or dull?
Sharp. Dull. Sharp. Dull. Dull.
Perfect. Okay, so now we're going to test out your near and far vision. So I got a little chart here. We're going to start with the near vision first. So I'm going to have you hold it just midway away from your arm's length away, as you would be reading a book or something. And then we're going to have you cover up one of your eye, and then we're going to switch it here in a second to test out your visual acuity. So I want you to read the farthest line down that you can read. Right
No matter which eye I cover up first.
Cover up your left eye first. Yep.
Okay. 8, 7, 4, 2, 8, 4, 3.
Okay, perfect. Now I'm going to have you do it again. And let's do it this eye right here.
Okay.
Cover up your right.
8, 7, 4, 5, 6, 3, 9.
Perfect. Perfect. Do you feel like you had any problems with that?
No.
Okay. All right, so now we're going to check out your far vision. And I got a chart over here on the wall if you look over here.
Okay.
Here's the chart I'm going to want you to look at. And I want you, you've probably done one of these before, but I want you to read down as far as you can. I want you to cover up your left eye first and do that. Will you read that for me?
F E L O P Z D.
Good, good. Okay, now I want you to do the same thing, but let's cover up your other eye. Can you read it for me?
F E L O P Z D.
Perfect, thank you. Okay, so now we're going to take a look at your eyes here, and I'm just going to kind of look at them and inspect them. And I put on some gloves here, and I'm going to kind of take a look at your eyelids. I'm going to pull it down. Can you look up for me? That looks good. Do the same thing here. Wonderful. I don't see any issues with your eyelids or anything. So now I'm going to check out your corneal reflex. So what I'm going to do, I'm going to got a little cotton swab here, and I'm going to touch the outside of your eye, and it's probably going to cause you to blink. And we're just going to check out that reflex. Good. Perfect. Okay, so now I'm going to examine your eye with an ophthalmoscope. And the first thing I'm going to do is to check out your red reflex. So I got the ophthalmoscope right here, the pen. And I'm going to be 20 centimeters away, and I'm going to be looking at your eye. And then I'm going to come up and get closer. I'm going to look at your cornea, look at your artery there. That's good. I'm going to do the same thing with this other eye over here. Just keep looking straight ahead. Perfect. Coming in close. That looks great. Okay, so now that I got that done, I'm going to check out your reflexes to light. So I got a light source here, and I just want you to keep looking ahead, and I'm going to check out your pupil responses to light here. So I'm coming across, just look straight ahead. Good. Come on this side. Good. I'm going to come all the way across, keep looking ahead. Perfect. Alright, so now we're going to test out your hearing acuity. So we're going to do a little test, and what I'm going to do, I'm going to say three, I'm going to come step behind you and whisper in one of your ears three letters, or number. I'm going to do numbers. We're going to do three numbers.
Okay.
And then I'm going to have you repeat it. And with the other ear, on the opposite side, I'm going to have you block it off with one of your fingers. Just kind of wedge it in there and kind of do a circle so you can't hear.
Okay.
So I'm going to first test out this right side. So let's have you plug your ear with your left hand.
And
your
I've
left
got to
finger.
kind of move it in there.
Yeah, just kind of wiggle it in there.
6, 10, 4.
Perfect. Okay, now we're going to do it on the other side here. Plug that other side.
11, 5, 1.
Perfect. Okay, so now I'm gonna inspect your ear, your external ear, and kind of look at it, and then I'm gonna use an otoscope and look into your ear and view your internal ear. Sound good? Okay, so I'm just gonna kind of get back here. Let's have you turn your head that way just a little bit for me. Perfect. Just relax. I'm just looking at it. Okay, and I'm gonna lift up your ear and insert the otoscope and look inside. Perfect. Now we're gonna go and do it on the other side here. Perfect. Okay, so now that we're done testing out your ears, we're gonna test out your sense of smell. Do you feel like you have any problems breathing through your nose or smelling? Okay, so I got two different smelly things. They both smell good that I'm going to have you smell. So what I'm going to have you do, I'm going to have you close your right nostril first with your right hand, and then I'm going to have you smell out of your left nostril. Smell. What does that smell like?
Oranges.
Perfect, that's right. Okay, I'll give you just a second. We're going to do the same thing, but we're going to be smelling out of your right nostril this time. So I'll have you close it with your left. Smell that one.
Smells like bubble gum.
Perfect. Yeah. All right. So now I'm gonna take a look at your nose. I'm gonna kind of inspect the outside of your nose, and then use the otoscope and look up your nose with the light, and just kind of do things like that. So I'm first gonna kind of feel your nose. Do you have any tenderness?
No.
Anything abnormal there?
Nope.
Feels good. Okay. And now I'm gonna have you tilt your chin back, and I'm gonna kind of insert this into your nose and take a look up your nose. Okay, and then check out your other one as well. That looks good. Okay, so now I'm gonna do a little bit of assessment on your mouth. I put some gloves on here. I'm just gonna kind of look at your lips. Look at the contour here. They look pretty good. Okay, I'm gonna have you open your mouth for me. That looks good. Stick out your tongue. Go ah.
Ah.
Good. That looks good. I want you to move your tongue side to side for me. Good. That's good. Put it back in there. So can you open your mouth again, and I'm just going to kind of look at your gums. Just kind of like you're at the dentist office. That's good. Okay. All right, so now I'm going to test out your gag and reflex here. I got a tongue suppressor here. So I'm going to have you open up your mouth, and I'm going to stick it in the back of your throat. You definitely have a gag reflex. Perfect. Yep. All right, so now we're going to do a little bit of assessment on your swallow. I'm going to check out your thyroid and a few things like that, okay? Mm-hmm. Okay, so first thing, I'm going to have you tilt your head up, and I'm just going to kind of feel around here. Feel 2 fingers. That looks good. Okay, I got a cup of water here for you. Okay, so I'm going to kind of fill the side of your throat here as you swallow this water. So go ahead and swallow that water. Perfect. I'm going to do the same thing over here. Perfect. Alright, so I'm just going to test how strong your neck muscles are. I already saw your range of motion earlier. We're going to kind of do the same thing but resistance. So I'm going to have you try to look to your left there, and I'm going to keep your head from turning. Perfect. Let's do it the other way. Good. Now let's lift it. I want you to shrug up your shoulders, and I'm going to push down. Good. Any discomfort doing that?
No.
Perfect. All right, so now we're going to do the assessment part on your pulmonary system. So ideally I'd bring down the gown in this situation, but for privacy reasons we're not going to. But I'm going to palpate just some of your muscles here on your chest. They seem pretty good there. All right, so now I'm just going to check out your back muscles here. All right, so now I'm going to place my hands here on your back, and I'm going to have you take a couple big deep breaths in and back out. Just take a big deep breath in. Good. Breathe out. One more. Perfect. Okay. That's good. Okay, now we're going to do the same thing here in the front. So take a big deep breath in. Good. Breathe out. One more. Perfect. So now we're going to do a little bit of percussion. So I'm going to kind of put my fingers back here, and you're going to feel me tapping on certain parts of your back here. It shouldn't hurt at all. Okay. So now I'm going to have you raise your arms up, both arms. We're going to do it right here on the side of your ribs. Same thing. Okay, and I'm going to come around and do it on the other side here. Okay, that's good. All right, and ideally you'd be doing this to bare skin to get a good sound. Okay, now that we're done doing the percussion, I'm going to listen to your lungs here. So you're going to feel the stethoscope, certain parts of your lungs. All right, just want you to take a big deep breath in. Okay, breathe out. Good. Do it again. Good. Another one. Good. Good. Another one. Good. Another one. Another one. Okay, two more. Good. Perfect. So now I'm going to listen to your sides and then down your front as well. So I want you to stick your arms up in the air for me. All right, I'm just going to listen down. Right up here on the side. Big deep breath. Good. Another one. Good. Another one. Another one. Another one. Good. Now I'm going to listen. You put your arms down. I'm just going to listen to the front here. Okay, so now we're going to do the cardiovascular part of the assessment.
Okay.
So ideally, I'd have you take off your gown, do the scan, but for privacy reasons, we're not going to do that to you here. But what I'd be looking for, I'd be looking at your chest here, looking to see if I can feel or see a heartbeat there. And then I'm going to palpate it. Palpate up here, right down here. Right here. Down here. That's good. And I'm going to feel that and then feel your pulse up here and see if they match. Okay, and now I'm going to listen to your heart here. I'm going to listen to several different locations, listening for murmurs, listening for the different heart sounds. We'll start right up here on the top. Okay, so now I'm going to listen to your heart laying down here, and then after that I'm going to roll you onto your left side and listen to it again. Okay. Let's listen right here. Okay, let me help you roll onto your left side there. Perfect. That's good. All right, so now I'm going to take a look at your carotid arteries again here. So I'm just going to be looking at them. I'm looking for jugular vein distension as well. I don't see that. I'm going to palpate right here. Okay, and I'm also going to auscultate or listen to it as well. Okay, so the next part of the assessment, we're going to do an assessment of your abdomen. So to do this, we're going to lay you down flat, and then I'm going to pull up your gown and put a sheet over your lower half to give you some privacy. Does that sound good?
Yep.
Okay, lower you down, lay on back here. There we go. The sheet right here. Gonna lay over you. Keep you covered up the best you can. I want you to expose your abdomen all the way up to your chest the best we can. That's perfect. Alright, so the first thing is I'm just gonna kind of look at your abdomen. Okay, I want you to lift your head up off the ground now. Perfect. Looks good. Looks good. Okay, so now next thing I'm going to auscultate your abdomen. So I got my stethoscope here. I'm just going to listen around here. Got some very active vowel sounds. Here. Alright, so now we're going to do percussion of your abdomen. And since you're pregnant, you've asked me not to do that, but I will show you kind of where I would percuss. So I'd start right here, go in, kind of like that, in a roundabout manner. Kind of like that. And then the same thing with the liver. We want to percuss your liver here as well. So what we do, we start down here lower and kind of go up on the border. And as soon as we hear the change, about right in there, I get a marker, mark it, come from the top side, do the same thing coming down. So it'd be about right in there, and I'd mark that. And I could also do it right there. And the same thing with the spleen. It's going to be right on this side. Just going to be kind of percussing down in line and then coming back up as well. The next part of it is just kind of palpation of the abdomen, kind of feel around in there. Any tenderness with that?
Nope.
Okay. Alright, so now we're going to palpate for your liver. So what I'm going to do, I'm going to cut my hand down here around your back. I'm going to have you take a big deep breath in, and I'm going to feel for it, okay? Big deep breath in, right here below the rib. Okay, relax. And I'm going to do the same thing, but this way. Big deep breath in. Any tenderness with that?
No.
Okay, and now I'm going to check out your spleen over here. So I'm going to kind of reach around. Okay, big deep breath in. Okay, and then here, you've asked me not to do it again, but checking the aorta, I'd come across right here and kind of squeeze and feel if I could feel the pulse coming up. Alright, so now we're done with the abdominal assessments. We're going to assess your femoral artery down here and some of the lymph nodes around that. So we can pull down your gown again. Good, and bring it down, and we'll kind of come down here, keep your legs a little bit covered for you. Let's have you open your legs up. So the first thing I'm going to be feeling for is just some lymph nodes. The only thing is I'm going to feel your pulse down here. Okay, I'm going to do the same thing on this side. Alright, feel for your pulse on that side. Ticklish or what? Strong pulses. Okay, and I'm going to listen to it as well. Ideally, this would be on skin as well. That's on that side. Okay. Good. Okay, so now we're going to cover you up. We're going to assess your knees and down to your ankles and feet. So I'm going to pull this off your legs here. Alright, so I'm just kind of look at your knees. Have you had any problems with your knees?
Nope.
Look pretty normal. Okay, I'm going to feel back here for your pulses. And there it is. Let's see if I can do this one. Okay. Do you have any problems bending your knees?
Nope.
Okay, we'll assess that here in a minute. We're going to check out your feet here as well. So I'm going to feel your pulses down here into your feet. Right back here behind here. I'm just looking at your feet here. Look pretty good. And check out your toes. Got nail polish, a little harder to see. Check one of your reflexes here. Fan your toes a little bit. You are ticklish. Okay, okay, so now we're gonna test out your motor function of your shoulders and your elbows specifically. So I've already done this once before. We're gonna do it again. So I want you to lift up on your lift up with your shoulders. Perfect. Okay. Now I want you to bring your arms back as far as you can behind you and try to crisscross them. That looks good. Let's have you rotate around. Good. Any dysfunction with that? Okay. Turn around again. Let's have you reach one all the way across as far as you can across your body. Any discomfort with that? Other one, keep your arms straight, come across the body. Good. All right, so now I'm going to have you lift up your arms against my arms, holding resistance here. So lift up your arms. Good, strong. Hold them up. Try to come down. Good. Good. Now we're going to do your elbows. So the same thing. I want you to curl your arm up. Bend it back out. Any discomfort with that?
Nope.
Same thing over here. Curl your arm up. Back down. Any discomfort with that? Let's do a little bit of resistance. Lift up resistance. Shoulder popped. Come back down. Looks good. Pull up. Good. Down. That's perfect. Okay, so now I'm going to have you do a combination of bending your elbow and your shoulder. So I'm going to have you bring up your arm and bring it up over your shoulder. Any problems with that? Okay, do the same thing, bend your elbow, lift it up over your shoulder. Okay, that's perfect. Okay, so now we're going to just see the rotation here on your wrist, a little bit on your elbow. So I'm going to have you bring your arm in and roll it towards you. Yep. Perfect. Then go the opposite direction. Any discomfort with that?
Nope.
Okay, let's do it with the other hand here. So kind of go in, and then all the way back out, and back in. No problem with that either? Okay. Okay, so now we're going to test the range of motion of your hand and a little bit more of your wrist here. So first off, I want you to twist your hand like it's in a fist. Perfect. We'll see you do that with your left hand as well. Perfect. Any problems with that?
Nope.
Okay, I want you to open them back up and keep your fingers close together. Get your thumb down. Perfect. No, spread them all apart. No problems with any of that?
Nope.
Okay. So I want you to lift your wrists up together and push them back down. Lift them up, push them down. Any discomfort with that?
Nope.
Okay. So I want you to keep your palm of your hands straight together and then bend your knuckles down, kind of like that, if you can. Perfect. Can you do that with the other hand? Perfect. That's good. Okay, so now we're going to test the range of motion of your hips. So first thing I'm going to do, I'm going to have you bring up your right leg and try to touch my hand up here. Good. Go back down. Any issues with that?
Nope.
Left leg. Good. Okay, I want you to lift up your leg against resistance. Good. Now push down. Any problems with that?
Nope.
Okay, let's have you bend your knee up. Okay, perfect. Any issues with that?
No.
Come back down, bend your other leg up. Perfect. Come back down. Okay, now I want you to spread your right leg out here and touch my hand out here. Good. Bring it back in. Do the same thing. Left leg. Okay. Now I'm going to do the same thing with a little resistance. I want you to push out with this leg. Any issues with that?
Nope.
Okay, bring it out here. Touch my hand. Now come back in. Resistance. No problems. Okay, bring this leg out with resistance. Okay, come out. Try to bring it back in. Perfect. Okay, so now I want you to touch your knee to the top, or your heel to the top of your knee on that side. Perfect. Come back down. And then do the same thing over here. Okay, bring it back down. Then I want you to bend your knee right here. Bend it up, and I want you to cross it over as far as you can. Perfect. Okay, come back down, do the same thing on this side. Bend your leg up, rotate it. Perfect. Any problems with that?
Nope.
Okay, so now I want you to stand on your left leg, and I want you to bring your right leg up, kind of bend it up like that. Hold it. Okay, and go back down, and then same thing on the other side. Good. Go back down. All right, now I want you to lift your leg out a little bit, and I want you to rotate your ankle just like that. Perfect. And I want you to rotate it inwards. Any discomfort with that?
No.
Okay, let's do it with the other side there. Extend your right leg outward. Perfect. Now go inward. Good. Okay, now I want you with your left leg to bend it up and then flex it back out.
Left leg?
Yep.
Do what?
Flex your ankle up and back down. Perfect. Let's do the right leg.
Oh.
Oh. Balance up and then back down. Perfect. That's good. Okay, so now I'm going to test your pain and a little bit of sensation here on your feet and your lower extremities.
Okay.
So I got a paper clip thing in, just kind of how we did it on your face. We're going to do it with your feet. So I want you to tell me when you feel a sharp pain and when you feel dull pain and the location of it. So I'm going to have you first of all close your eyes. All right, and I'm going to do something here. What is that?
Sharp on the inside of my foot.
Okay.
Sharp on the top of my foot.
Which foot?
My right foot.
Good.
It's a dull pain on the outside of my foot.
Good.
A dull pain on the top of my left foot.
Good.
A sharp pain on the inside of my left foot.
Good.
A sharp pain on the outside of my left foot. A sharp pain on my big toe on my left foot. A sharp pain on my big toe on my right foot.
Perfect. All right, so now I got a little bit of a cotton on the end of this swab here, and I'm going to do the same thing. So I'm just going to be kind of brushing on your foot, and I want you to tell me where you feel the sensation, okay? So
Okay.
close your eyes again.
On the inside of my right foot. On the outside, kind of by my pinky toe on the top of my right foot.
Good.
Close to my heel on the inside of my left foot. On the top outside of my left foot. On the top inside of my left foot.
Okay, that looks good. Okay, so now I am going to do another test where I'm going to grab onto one of your big toes, and I'm going to move it either up or down, and you're going to have your eyes closed, and I'm going to need you to tell me what direction I moved it. Okay, so I want you to close your eyes. And I'm going to grab onto here.
Down. Down. Up. Down. Up. Up.
Good. All right, so now we're going to assess a couple of your reflexes, your patellar reflex and your Achilles reflex. So what I'm going to have you do, I'm going to have you get your upper arms, and I'm going to have you grab them like this. I want you to start pulling them apart as I do this, okay? All right, just relax there. I don't have a reflex hammer, using some scissors. Good. All right, the same thing, keep pulling your arms apart here. I'm going to come back here, keep your hand in the spot there. That one definitely worked. Both of them worked. Perfect. All right, so now I'm going to test a couple of reflexes on your arm and wrist area, okay? All right, so I'm going to grab onto here. I'm going to bend your arm up just like that and just kind of rest it on my arm there. Perfect. Do it over here as well. Rest your arm on mine. Beautiful. Okay, I'm going to do the same thing right over here. Just kind of rest your arm. I'm going to hit one right here. Okay. Do the same thing. Kind of rest your arm there. Good. And we're going to bring your arm up here. Kind of 45-degree angle. Relax your arm. I'm holding it. Doesn't want to move a whole lot, does it? Just relax your arm. There we go. Got it. Okay, so now we're going to do a couple of the coordination movements. So we earlier did the finger to nose thing, so we're not going to do that again because I've already seen that. So what I'm going to have you do right now, I'm going to have you bring your left heel and touch your right kneecap. And back down. Do the same thing the opposite way. No problems that way. Okay, so now we're going to do coordination with your hands. So I'm going to have you lay your hands down on your leg like that. Then I want you to rotate them back and forth for me. Yep, just your wrist. Try to keep your wrist down. There you go. There you go. Not slapping. Do it quick as you can. Perfect. Okay, that's good. So now I'm going to have you do the coordination with your fingers. So you're going to start with your thumb and your smallest fingers and work all the way up and back down. Try to do as fast as you can, but touch them all. Perfect. That looks good. Okay, so we're about done with the physical examination. The last thing we need to do is just kind of test your gait or how you walk. So I'm going to have you start right there, and I want you to walk right over here to me. Looks good. Alright, now I'm washing my hands after saying goodbye to the patient.